All right, next question from Pulaski County Treasurer / Collector Deborah Buckner. Healthcare reform has resulted in a new landscape for providers and employers alike. Counties are just now beginning to learn what the impact will mean for them. The counties of Arkansas employ over 13,000 people collectively, and substantive cost increases could prove to be catastrophic. Do you think the healthcare reform package will result in cost increases to our counties? And if so, how do you propose that this be handled? Congressman.
Well, I think it's going to result in cost increases without a doubt. The flaw in this bill, and there's many flaws, but the major flaw is the problem that we have is cost containment. There's absolutely nothing in this bill that controls cost. Costs are going to continue to increase. You're seeing that right now. As I mentioned earlier, seniors have figured out in their particular, and this impacts your counties, the people in your counties, the ability for them to spend. They figured out that if you cut Medicare by $500 billion, something's got to give. I'll tell you another real problem. This bill is very hard on community hospitals, rural community hospitals. What's going to happen is that employers are going to figure out it's going to be cheaper to pay the fine, move their people into the government subsidy. As they do that, costs are going to soar. As costs soar, then rationing will occur, consolidation will occur. When you look at the models in Canada, when you look at the models in the United Kingdom, when you look at our VA system, we've got hundreds of thousands of vets. We've got 2 good VA hospitals. So you're going to see consolidation. And I'll tell you, as you lose your community hospital, you lose your doctors. That's one of the first things that industry looks at when it comes in. And then you lose your community. I was visiting with a manufacturer in Fort Smith. As a result of this bill, it's going to cost them $2 million a year. They're looking to see how that they can, be in a situation where they can mechanize. They're going to be laying off 50 people in the next year or so to meet that mandate. Why do you do it again in a situation where the economy is so fragile? Why do you do these things that are absolutely job killers? The state of Arkansas, it's going to cost them $200 million a year because they're going to have to expand their Medicare coverage. Where's that going to come from? We're talking about the problems that face you now. The reality is that's going to be less money for roads, it's going to be less money for schools, and less money for county and city government. Thank you.
For years while I've been in office, I've been hearing consistently from constituents about the increasing cost of insurance and the lack of availability of it. So many different issues that we have faced in healthcare. Our healthcare system is broken, and if we don't act now to do something about it, not to say that the healthcare bill that we've passed is perfect. I've already signed on as a co-sponsor of an amendment to correct some of the things in the small business bill that we'll be taking up this fall that will correct some of that for small businesses. But the fact is, we've got to move our system from one that focuses on reimbursing for volume to one that reimburses for value. And I would take issue with some of the things that the Congressman has mentioned. Quality of rural health care was one of my top priorities as we debated this bill. I focused on several things, but rural health was one of the critical ones that I focused on. Small businesses was the other, and Medicare and strengthening it. Losing $200,000 or $200 million in Medicare, I don't know where he gets those numbers. I mean, the fact is we add 12 years of solvency to the Medicare Trust Fund in this bill. It is a deficit neutral bill. The fact is, and for small businesses, if you are a small business of 50 or less, you don't have to meet any of the mandates that are in the bill. You're exempt from those mandates. I worked hard to save 8 of our rural hospitals, our community hospitals out there, to ensure that they would not have to experience any reductions from Medicare reimbursement rates, making sure that they would be able to save their jobs and continue to serve people in their communities. There's so many important things in this bill. It is not perfect, but it is getting us down the road to where we need to be. We have 500,000 Arkansans that are uninsured. There's so much misrepresentation. I've been out in the county courthouses, people trying to tell you that your portion that is covered by your employer is going to be taxed. It absolutely is not going to be taxed. It has to be reported on your W-2 only for reporting purposes to ensure that people know you are insured. You will not have to pay taxes on the portion that you pay in that. It is still going to be taken out of your payroll check, pre-tax dollars, just like it always has been. So I hope that all of us can work to make sure that there'll be better health care for all of us throughout our state, and that our nation, and I'm going to continue to work to improve upon that bill.